Hi, I'm Danielle Matias at Caring Medical Florida. I'm hoping to answer some common questions that we get about pelvic floor dysfunction and the types of cases that we see here at Caring Medical. Pelvic floor dysfunction, there are multiple causes of it. Cases that we get involved in and that we treat are cases that involve injury to any of the soft tissues that stabilize the pelvis. So that may be injuries to any of the ligaments that stabilize our lower back, like our sacroiliac joint, and those ligaments around our sacrum, or even the pubic symphysis in the front of the pelvis, and any kind of muscle and tendon attachments in between. So to look here, this is a picture of someone's back. So like here is the tailbone down here, here's the sacrum. All of these kind of whitish, grayish tissues, those are all representative of the ligaments that help stabilize the sacroiliac joint. And then here, of course, are muscle attachments around. So somebody that has chronic low back pain or suffered a low back injury where any of these ligaments become stretched out and loose, kind of like loose rubber bands, may have pain and may go on to develop like a pelvic instability. This is more kind of like an aerial view of the pelvis. So here, kind of like what we saw right here, this is the sacrum kind of coming down to the tailbone, and here's the pubic symphysis. So this is a main stabilizer of the pelvis on the anterior or the front side. And then you have this whole kind of bowl of muscles that helps support the pelvic floor as they attach around this ring. So just again, people that have pelvic floor dysfunction related to soft tissue injuries can have injuries to the pubic symphysis, where that's kind of stretched out and become wider and more lax and more loose than it should be, or injuries to the sacroiliac joints, the main stabilizers of the posterior or the back of the pelvis, or they may have both, and things are kind of like seesawing back and forth. And all of these muscles in here are spasming and tightening because they're trying to stabilize the pelvis. They're trying to protect those injured, unstable areas and help to keep you, as balanced and as upright as you can be. So in cases where people have these types of injuries that we can find with ultrasound or in physical exam, those are often cases that we will treat successfully for pelvic floor dysfunction. Patients like this, maybe they had a car accident or some kind of trauma, or they were an athlete and they just kind of pushed through pain and never really dealt with anything, or even women after childbirth. Anything that can stretch out these ligaments and cause this imbalance and this dysfunction in the pelvis, those are often cases that we see. And these patients may have tried everything. They may have tried physical therapy. Like they say, oh, your pelvic muscles are tight. We're going to send you to pelvic floor physical therapy. We're going to work on loosening them up. Maybe it doesn't work for those patients. They try as hard as they can. They try with all their might to loosen these muscles, but they just keep spasming. They just keep tightening again. Well, we know that those muscles will tighten in the presence of loose ligaments and loose joints. So if the therapies that are aimed at the muscles aren't working, it likely isn't a muscle problem. We have to dig deeper to really figure out what's going on. Conditions that can be related to pelvic floor instability, some of them we kind of touched upon, but like coccyx pain, ischial tuberosity or butt pain, that's the bony prominence that we sit on. Even psoas and iliotibial band or IT band syndrome, sometimes even related to the hip can definitely be involved with pelvic floor dysfunction because again, that hip is anchoring into the pelvis. So especially if somebody, again, has had an injury or even a chronic case that's gone on for a long time, the hip can sometimes be involved, always something that we want to check. Pregnancy low back pain, I know a thing or two about that. Vulvodynia, kind of a blanket diagnosis for vaginal pain. All of these can actually be related to a pelvic floor instability. Maybe not every case, but some cases are. Interestingly, I had a case recently of a woman, she doesn't live in Florida, she lived far away, but she emailed us because she had like a recurrent a vaginal itch actually, which doesn't, maybe sound like things that we would normally see, but she had, a laundry list of therapies she tried and people that she's seen. And she also, so she had reached out to us deciding, would you be able to help my case? And especially when people are coming from far away, I don't want people to just hop on a plane and come here unless I think that there really is a chance that we could help them. And so I reviewed her case and asked some more questions. Well, turns out she did have actually a history of injury. She did have low back pain, clicking and popping in her back. She did have, some pelvic, like soft tissue injuries. So I said, okay, let me evaluate you. I don't know what we'll find, because vaginal itching is not typically a symptom that we would treat, but let's see. Well, she comes out and lo and behold, she does have SI joint instability that is irritating her pudendal nerve. She does have a wide pubic symphysis. So like that pubic symphysis that should be kind of tight and held together had been stretched out. Like she did have these positive physical exam findings, we call them, for pelvic instability, which is why I took on her case and treated her. In cases where people have maybe pain or dysfunction, but they don't have any instability, like the pubis is not unstable, the SI joints aren't unstable, those may not be cases that would respond well to prolotherapy or PRP. But in her case, because she had a lot of those findings, where she's under our care now. This is the sacrum, and then you've basically got 3 big nerves that come out of your sacrum that merge to form your pudendal nerve that travels through the pelvis. The pudendal nerve is responsible for innervating tissues, such as the vagina or even parts of like the male genitalia. And so people, especially women, I see a lot of pelvic floor women, they might have a lot of vaginal pain or vaginal burning or even numbness, like complete numbness, pain with intercourse, even just pain doing any kind of sport or walking or activities, or just complete loss of sensation. These are things that can be related to the pudendal nerve. And especially like if somebody has an instability, like let's say the sacroiliac joint here is unstable and it's moving more. Well, if your sacrum is moving more, what's going to go along for the ride are those nerve branches that make up the pudendal nerve. And that's why some people have symptoms on both sides, but some might only say, hey, like only the right side of my vagina goes numb or it hurts, because it just kind of depends on the way that that bone is rotating or the way that those joints are unstable. In cases where people have significant pudendal nerve symptoms in the presence of instability, a lot of times we'll actually treat the ligaments of these joints, we'll treat that pubic symphysis attachment, and we'll actually do injections around the pudendal nerve as well. We might put PRP around there to work on like nerve regeneration and nerve healing to help their symptoms go away. There definitely are times where somebody might have a pudendal neuralgia in the absence of any kind of instability in the back or the pubis. Typically, those cases don't get to us, quite frankly, because they've done injections somewhere else. They've done pudendal nerve blocks or tried other therapies and they do well with that. Typically, the cases that we see are ones that tried other therapies like I described and they're not better because people are missing that instability. They're not picking up on the fact that the pelvis is actually unstable. So those are the cases that tend to do really well and have really great results at our clinic.